The key things I'm going to talk about are two sexual relationship patterns, which are cross-generational sex and also having more than one partner in sexual relationships concurrently. So I will begin by defining the terms, and then I will talk about the facts which are related to these two sexual patterns. And then I will also talk about what causes or what reasons make them to prevail in Tanzania, what are their consequences, and why are they really of a concern to Tanzania by relating them back to HIV/AIDS risk. And after that, I will show what Johns Hopkins has tried to do as interventions and what we can learn from these interventions for future programs to prevent HIV/AIDS. So concurrence, known as multiple concurrent partnership, MCP, is defined as overlapping sexual partnerships where sexual intercourse with one partner occurs between two acts of intercourse with another partner. And then the second sexual relationships I'm going to talk about is cross-generational sex. And this is a non-marital relationship with an age difference of 10 or more years. But to emphasize on this, I want to show you that why we are really concerned with cross-generational sex. Because, for instance, over 45% of young girls from 15 to 19 who commit abortion in Tanzania do report to having a relationship with a man either between 30 to 39. And then 28% they report to having a relationship with a man over 40 years. Therefore, this is why it's of great concern to the public health. As I said, they are both related to HIV risk. And you can see Tanzania has a prevalence rate of 5.1. And every year we get like 2,000 new cases of HIV. And this happens despite of the knowledge of HIV prevention knowledge. And the estimate of HIV prevalence in the specific group I'm discussing, the 15 to 24 years, the young females, is 6.2, more than that of males of the same age. And this is a very important group for the cross-generational sex relationships. Cross-generational sex relationship is a driver of HIV infection, specifically for women, because generally it involves imbalance in power relations. And there's always an element of transactional sex in it. And therefore, in this transactional sex, despite that women have a kind of an edge in detecting the prize, but once the sexual relation starts, the sexual terms are unequal. And we will see this as we proceed. Otherwise, the HIV/AIDS epidemic in Tanzania is driven by a number of factors, but our focus is on this SGS, which is sex practices. So there are two forms, girls as victims and girls as active social agents. In the latter, they actually enter into these relationships willingly for financial and material gains. Now let's switch to concurrency. Concurrence also is very important because of the way of the rate of transmission in HIV happens. So as you can see, you could be in a relationship where is monogamy and you feel you're very comfortable that you have just one partner. But this one partner could be having many partners. So you are not at all safe. You may be thinking you are there, you and your husband, or you and your wife, but apparently one of you could be connected to other sexual partners. And these sexual partners can be a risk to you in infection of HIV. There are cultural, social, and economical reasons. For example, historically, in African countries broadly, young females were trained or they were encultured to expect marriage just when they reach their onset of puberty. And therefore, when they reach the age where they are adolescents or they become women, then they are told that older people are the best people to have stable marriages, and they also have authority in the society. Therefore, they are good suitors. And apart from that, historically, African culture expected men to share resources and convey their love and commitment through material gifts. And also, men sought to engage in a sexual relationship with a girl from the parent. So you can see, even up till now, in some of the societies which are still condoning these kinds of customs, if a man came to the parent and asked to be betrothed to a young girl who is still at school, some parents, because of economic reasons, will consent to that. Again, young women themselves enter into CGS because of financial and material gains as a primary reason. But also, research has also shown that they also seek love, marriage, and sexual fulfillments in these relationships. Now, we can relate this with the culture, because they believe that some men could be honest when they come to them conveying their love through material gifts. Other reasons are women themselves. According to research, women themselves nowadays perceive themselves as commodity. Their body is perceived as a commodity, and therefore they believe that they can sell their body for both material gains and in addition to sexual pleasure. As well, there is peer pressure. Why is there peer pressure? Because a girl's social respectability also comes from engagement in cross-generational sex. Why? Because from cross-generational sex, somebody can acquire material benefits, somebody can show to the others that she's worth of something. Another thing also which is causing this sexual relationship pattern to prevail is the remnants of the tradition that young women are not, it's not useful to educate young women. There are some societies or ethnic groups in Tanzania which are still thinking that it's a wastage of time to educate a woman, but we should only educate the men. On the side of men, for them it's more beliefs of the desire for sex, affirming masculinity, and also very interesting, which now several research have found out, is seeking HIV safe segment of the population. So there's this absurd or this popular thinking that the young girls do not have HIV, because the entire population is kind of like nobody knows who is safe. So these older men consider the young girls to be safer in terms of HIV prevalence. And again, also men want to increase their social respectability with their peers. If we look at MCP now, the concurrency sexual relationship partner, they are emotional and financial reasons to why it's prevailing. First, the greatest one is dissatisfaction in relationships. Men or women desire sexual variety, they desire sex frequently, and they also want enhanced sexual pleasure. And a very key factor, which actually now is causing them not to get this, is a norm called sexual responsibility. And this is a norm existing also in some of the research which is done in Brazil, that there is a strong adherence to communication language about sexual issues in Brazil and the same in Tanzania. Therefore, a husband cannot speak vulgar to a wife, or a wife cannot speak vulgar language to a man. So you cannot necessarily talk about sexual variety or even introduce some sexual variety acts in marriage for fear that you will lose or you will decrease your sexual responsibility towards your wife. And it's also connoted with what is called sexual respectability. You will lose your respectability. On the side of finance, it's quoted that women need more than one partner to stabilize their life conditions. Another reason men are unable to control their sexual drive, we'll also see peer pressure from friends, also an expression of economic power. If a man can take care of more than one partner, then they have a social respectability in their peers, because then they show them that they can manage more than one partner. Another reason is pronounced acceptability of the practice. In Tanzania, it is very, very widespread. It even has a name in our local language. It's called nyumba ndogo, which is called small house. So almost any man would consider having a small house in addition to their main partners or to their marriage. There's even a joke: when you have an increased salary, people would say, now you can have another small house. And small house can be more than one. You can have many small houses. And there is even an accepted vocabulary or language which goes with MCP behavior. For instance, people would praise those people who are engaging in MCP and call them the gifted brain, or in Swahili, kichwa kikali. And then they will ridicule someone who is only sticking with one partner, or his wife or her husband, and they call them soaked rice or bwabwa. At the same time, MCP produces transactional sex, and transactional sex is used actively to get economic resource by women. It's used as an economic resource by women. Studies now have shown that women consider this as power, actually. Before, studies used to say that women are being demeaned by engaging in transactional sex. But nowadays, it's the other way around. If you engage in sex without a transaction, actually that's what is demeaning. So there has been some development in that literature. But also insecurity, fear, and abandonment of one partner is also another reason why MCP prevails. So that's why people have backups of another partner. And mistrust, as well as post-abstinence of the main partner. This is a belief that when you're in a relationship with your wife, when she's breastfeeding, then you cannot have sexual relationship with her because it will harm the child health-wise. Therefore, men tend to go out of the house when their wives are breastfeeding. And all these are research-backed. If we begin with SGS, there are health risks, pregnancies, abortions, abandonment, betrayals and loss, because some girls believed that they would be married. There's also financial burdens, both on the girl's family, if she delivers and brings the child, and then the parents have to shoulder, especially when the man absconds. And also there is financial burden on the man, because many of these men compromise the needs of their families so that they can take care of these other young girls. And also a loss to parents, because they were to expect some returns after they have taken their children to school. The side of MCP, again, we also have health risks. In both MCP and CGS, one of the key health risks, which is the same in both patterns, is the unlikelihood of using condom. As we talked in the CGS, there is an equal relationship, so there's very little bargaining power, and also this is actually enhanced with the age difference. But also when we come to MCP, the same thing applies. There is also unequal power relationships. Women can only negotiate at the point where they want the money. But once the man gives out the money, then it's the man who decides the sexual terms. MCP causes marriage breakups, divorces, which affect children. It also causes psychological effects, economic abuse. Can you imagine some women who are in marriage and their husbands are engaged in MCP, yet they still cannot go away. Some of them cannot divorce because they are not economically empowered. So they are just stuck there in a marriage which is abusive. They have to fend for all their economic needs from this man who actually is still engaged in another relationship or relationships. And even this woman is there at a very high risk of getting HIV. There's also intimate partner violence. Men can be physical when it comes to, because now the woman can decide also them to have another partner, but when the man realizes that, the man does not want the woman to have another partner, so they would occasionally beat the women. So what has Johns Hopkins been doing to try to change these patterns of sexual behavior? Johns Hopkins has a reputation of doing most of their intervention through mass media. So they are largely biased towards using mass media as a channel to educate and intervene in public health problems. So even to address these two sexual relationship patterns, they adopted the use of mass media, but also they used mobile phone, SMSs to reach people. They used a number of outdoor activities to reach people. And the aim of these interventions, for instance, for the CGS, they wanted to remove that social acceptance of cross-generational sex behavior by making people aware, and also calling for support from families and community to intervene whenever they see such relationships trying to emerge. On the side of MCP, the aim was to break the sexual networks and to also empower individuals to break themselves off the sexual networks, to be aware of how susceptible they are, and then to understand the severity of the situation, like the way I said that they could be infected, and then be able to remove themselves from the network. As I said, mass media campaign for both was used, and two big campaigns were launched. One called Fataki, and the other one called Tuko Wangapi Tulizana. Fataki is a term which which means explosive, something which can kill. So Fataki was a name given to a character who was designed to be praying for young girls. So he represented an SGS man, a man who wants to have relationships with young girls for sex. And the mass media campaign was launched in televisions, radio, banners, different types of advertisements, so that it can illustrate how this man, Fataki, tries to engage relationships with young girls, and at the same time some scenes illustrated how friends and families tried to intervene into these relationships and protected their loved ones. And on the MCP, also a lot of advertisement went on air, text messages were sent to people trying to ask them, for instance, what could be done to make you satisfied in your relationship? What are the ways can one be satisfied in their relationship? How can we communicate with our partners? How can we find safe ways to talk about vulgar things in a couple relationship? And this is the MCP campaign, which says Tuko Wangapi Tulizana, which means how many are we? Chill, because you do not know how many you are in a relationship. So it's asking how many are we? So if you are in a relationship, you should responsibly know how many are you in that relationship. And if you know you are only two, then just stick to two. If you know you are many, then ask yourself, let's stop this and only stick to two of us, because there's a risk of contracting HIV. Tuko Wangapi campaign had two phases. The first phase was more about knowing how many are we. And then the second phase, which is now running as I'm talking, is about settling down. After you know how many are we, then how do you entangle yourself out of that network, if at all you know you are many? In conclusions, there are lessons which we were able to learn from these mass media campaigns. For instance, from the SGS campaign, we were able to see that families and communities started seeing SGS from a negative light, and also they started recognizing the danger it possessed. Families started seeing the importance of educating their young girls. Also, families and communities started talking about how to protect, and not only how to protect, it's also triggered, because from the findings we got a lot of testimonies of how families and friends intervened in some of these relationships which were about to happen. And also, which was a very interesting finding in the evaluation, we also got to find out that there were some girls who refused to enter into this CGS relationships. Sorry. They mentioned parental guidance as one of the factors which helped them to refuse. On the side of MCP, I will only cite some evaluation findings from one media channel or one channel which we used, which was SMS texting. It was very significant because it created a safe environment where people were talking to us and the rest of the people in the communication network about different ways to solve issues of relationship dissatisfaction, issues of concurrence, issues of HIV risk, which is coming, or which is as a result of concurrence. So SMS allowed a lot of conversation about the sexual networks. And this made us realize that SMS is one safe environment for people to talk about concurrence relationships. Laws have been enacted at the government level to curb cross-generational sex. And actually, there are severe sentences for people who engage in sex with under 18 years. Okay. But the challenge has been to actually implement these laws. Yeah. Proof has been very difficult. And why has it been difficult? We still are very not exactly developed when it comes to forensic evidence. And this young female have to have forensic evidence in order to prove that, for instance, they have had forced sex with this older man. And sometimes, also in addition to that, many of these older men occupy authoritative positions. Some of them are school teachers, and they do it to their pupils. And some of these cases are not reported at all. So if it's a pupil or a student, she will not report it. Or even if she reports it, it will be word against word against her teacher. And it's also in the workplaces, or it's done with government officials who can easily play around the law. Okay, so using condoms has not been very instrumental because, for instance, for STS, it's more rampant with women who are uneducated or who are still in school. And with MCP, it's more also in the urban with women who are seeking economic returns. But your point is valid because there are women also who have power to decide. But those are fewer compared to those who cannot decide, yeah, in terms of use of condom. So it's more the men who are the ones who decide. And there's a popular belief that sex is better without condom. They have their role in terms of at the level of their community members. They preach about safe sex, they preach about sex within marriage only, and they preach about waiting for sex before marriage to the young girls. So for those who abide in that, they follow those norms. And also the church is also taking a lot of initiative to talk about the HIV risk within their spaces as well.